Welcome to this CCMA exam prep session. 25 key questions covering every domain on the NHA Certified Clinical Medical Assistant Blueprint. These questions reflect real exam difficulty, including clinical scenarios, procedural knowledge, and medical law. Whether you are studying for the first time or doing a final review, work through each question carefully, then check the answer and rationale. Let's get started. A medical assistant is preparing to administer an intramuscular (IM) injection into the deltoid muscle of an adult patient. At what angle should the needle be inserted? A. 15 degrees, B. 45 degrees, C. 90 degrees, D. 30 degrees. The correct answer is C. Intramuscular injections are administered at a 90-degree angle to ensure the medication reaches the muscle tissue. A 45-degree angle is used for subcutaneous injections, where the goal is to deposit medication into the fatty layer beneath the skin. A 15-degree angle is used for intradermal injections, such as a tuberculin skin test. Test. A medical assistant is performing a tuberculin skin test, TST. At what angle should the needle be inserted, and which layer of tissue is the target? A. 45 degrees subcutaneous tissue. B. 90 degrees muscle. C. 15 degrees intradermal layer. D. 30 degrees subcutaneous tissue. The correct answer is C. The tuberculin skin test is an intradermal injection delivered at a 10 to 15 degree angle just beneath the epidermis into the dermis, creating a wheal or bleb. Subcutaneous injections target fatty tissue at 45 degrees, and intramuscular injections target muscle at 90 degrees. Inserting too deep would miss the intended layer and invalidate the test result. During hand hygiene, the CDC recommends that healthcare workers wash hands with soap and water for at least how long? A. 5 seconds, B. 10 seconds, C. 20 seconds, D. 30 seconds.
The correct answer is C. The CDC recommends scrubbing all surfaces of the hands with soap and water for at least 20 seconds, roughly the time it takes to hum "Happy Birthday" twice. 10 seconds is insufficient to mechanically remove transient microorganisms. Alcohol-based hand rubs are preferred when hands are not visibly soiled, but soap and water is required after caring for patients with C. difficile.
A medical assistant places a patient in the Fowler's position. Which best describes this position? A. Patient lying flat on the back with legs elevated. B. Patient lying on the left side with right knee drawn up. C. Patient lying on the back with the head of the exam table elevated 45 to 60 degrees. Or D. Patient lying face down on the abdomen. The correct answer is C. Fowler's position places the patient semi-reclined at 45 to 60 degrees and is commonly used for patients with respiratory difficulties or cardiac conditions and during nasogastric tube insertion. Sim's position, lying on the left side with right knee drawn up, is used for rectal exams and enemas. Prone position, face down, is used for back procedures.
A patient is scheduled for a pelvic examination. The medical assistant correctly positions the patient in which of the following? A. Sim's position. B. Trendelenburg position. C. Lithotomy position. D. Prone position. When using standard precautions, which body fluid does not typically require personal protective equipment, PPE, unless visibly bloody? A. Blood. B. Cerebrospinal fluid. C. Sweat. D. Amniotic fluid. The correct answer is C. Standard precautions apply to all body fluids, secretions, and excretions except sweat, which is not considered a source of infection transmission. Blood, cerebrospinal fluid, amniotic fluid, and other moist body substances all require appropriate PPE. This exception is specifically listed by OSHA and the CDC in standard precaution guidelines.
Which autoclave setting is the standard sterilization cycle for most medical instruments wrapped in paper or cloth packaging? A. 121 degrees Celsius or 250 degrees Fahrenheit for 15 to 20 minutes at 15 psi. B. 100 degrees Celsius or 112 degrees Fahrenheit for 10 minutes at 10 psi. C. 134 degrees Celsius or 273 degrees Fahrenheit for 30 minutes at 30 psi. D. 115 degrees Celsius or 239 degrees Fahrenheit for 5 minutes at 5 psi. The correct answer is A. The standard gravity displacement autoclave cycle operates at 121 degrees Celsius or 250 degrees Fahrenheit and 15 psi for 15 to 20 minutes. This combination of moist heat and pressure destroys all microorganisms, including spores. Boiling water at 100 degrees Celsius achieves disinfection but not sterilization because it cannot kill heat-resistant spores, a common distractor that confuses disinfection with sterilization. Before administering a medication, a medical assistant should complete the 5 rights. Which of the following is not one of the 5 rights of medication administration? A. Right patient. B. Right dose. C. Right prescribing physician. D. Right route. The correct answer is C. The 5 rights of medication administration are right patient, right drug, right dose, right route, and right time. The identity of the prescribing physician is verified before the medication is dispensed, but verifying the physician's identity is not one of the 5 rights performed at the time of administration. Some sources add right documentation as a 6th right. A patient's oral temperature is 101.8 degrees Fahrenheit. The medical assistant should recognize this as A. Hypothermia, B. Normal adult oral temperature, C. Low-grade fever, D. High-grade fever. The correct answer is D. A temperature of 101.8 degrees Fahrenheit exceeds the low-grade fever threshold, 99 to 101 degrees Fahrenheit, and is classified as a high-grade fever above 101 degrees Fahrenheit. Normal adult oral temperature is 98.6 degrees Fahrenheit, range 97 to 99 degrees Fahrenheit.
A temperature of 101.8 degrees Fahrenheit warrants clinical attention and reporting to the supervising provider, as it may indicate a significant infectious process.
When measuring a patient's blood pressure, the medical assistant places the cuff too loosely. What is the most likely effect on the reading? A. Falsely low systolic reading. B. Falsely high blood pressure reading. C. No effect on accuracy. D. Falsely low diastolic reading only. A medical assistant is preparing to perform a capillary puncture on an adult patient's fingertip. Which finger is preferred, and why should the very tip and center be avoided? A. Index finger. The tip has the most nerve endings. B. Thumb. It has the largest surface area. C. Ring or middle finger. The very tip has thicker skin and less padding. D. Ring or middle finger. The very tip and center lack adequate tissue depth. The correct answer is D. The ring or middle finger of the non-dominant hand is preferred for capillary fingerstick puncture. The very center and tip of the finger are avoided because there is less tissue depth between skin and bone, increasing the risk of hitting the periosteum and causing pain or osteomyelitis. Punctures are made on the lateral side aspect of the fingertip pad where tissue is deeper.
Which type of wound closure is a medical assistant within scope of practice to apply? A. Absorbable sutures. B. Steri strips, butterfly closures. C. Interrupted sutures with non-absorbable thread. D. Surgical staples. The correct answer is B. Medical assistants may apply Steri strips, adhesive wound closure strips, as this is a non-invasive wound care task within their scope of practice. Placing sutures, whether absorbable or non-absorbable, and applying surgical staples are invasive procedures requiring a licensed provider. Scope of practice varies by state, but suturing consistently requires physician or advanced practice authority.
A medical assistant is setting up a sterile field for a minor surgical procedure. A sterile package is opened, and the item lands on the edge of the sterile drape. The correct action is to A. Continue using the item because it only touched the edge. B. Consider the item contaminated and discard or re-sterilize it. C. Wipe the item with an alcohol swab before placing it on the field. D. Move the item to the center of the field using sterile gloves. Which of the following is an example of a point-of-care test that a medical assistant may perform in an ambulatory clinic setting? A. Complete blood count, CBC, with differential. B. Blood culture and sensitivity. C. Urine dipstick, urinalysis. D. Comprehensive metabolic panel via mass spectrometry. The correct answer is C. Point-of-care testing refers to diagnostic testing performed at or near the patient's location using waived tests under CLIA. Urine dipstick urinalysis is a CLIA waived point-of-care test commonly performed by medical assistants. CBC with differential and CMP via mass spectrometry require laboratory instrumentation and trained laboratory personnel. Blood cultures require sterile collection and laboratory incubation.